Welcome to IMCAS TV, 10 Minutes with Dr. Grant Stevens. Welcome. And we're going to be speaking about Coolsculpting by Zeltica. A little bit about Dr. Stevens. You are a board-certified diplomat of the American Board of Plastic Surgery, professor at the University of Southern California Division of Plastic Surgery, director of the USC Marina Del Rey Aesthetic Surgery Fellowship, and the medical director of Marina Plastic Surgery in Marina Del Rey, California.
Thank you.
That's a lot. And we're going to talk about Coolsculpting by Zeltica, which was developed by Harvard scientists, targeting the stubborn fat, the fat that's really, really hard to lose. And Coolsculpting targets these fats, eliminating them in an easy, non-invasive way, quickly, effectively, and most importantly, safely. Welcome, Dr. Stevens. And before we start to chat, I wanted to go to a video, and then we'll come back and you can tell us why Coolsculpting is a true revolution.
Thank you very much.
Coolsculpting is the body contouring treatment that's transforming the aesthetic industry for both practitioners and consumers. It delivers a highly effective, non-surgical solution to reducing stubborn fat in diet and exercise-resistant areas, something never before available. Backed by robust clinical and preclinical data, patients experience an undeniable and measurable reduction of fat after just one 60-minute treatment. Coolsculpting has enticed new patients into aesthetic medicine. Its appeal is the perfect combination of efficacy, convenience, value, and safety.
Coolsculpting is based upon the research of two outstanding Harvard scientists who looked at the observation that cold could be applied non-invasively to remove fat. And this led to the discovery of cryolipolysis, the scientifically proven method upon which Coolsculpting is based. Coolsculpting targets and cools fat cells to temperatures that trigger their natural death. Importantly, because lipids in fact crystallize faster than normal cells, there is no damage to nerves or other tissue. Over the next few weeks and months, the fat cells shrink and begin to die as the patient's own body metabolizes them and naturally eliminates them. The overall fat layer is significantly reduced, which results in a noticeable and measurable reduction in the fat bulge around the targeted flank.
Coolsculpting has brought in a whole new patient population to the practice. Those people that have never had an aesthetic procedure before are now coming in asking for Coolsculpting by name. The ideal candidates for Coolsculpting are those people that have stubborn pockets of fat that are resistant to diet and exercise. The love handles, muffin top, so-called spare tire, these are the people that really do best.
Doctor, my first question is, what is Coolsculpting?
Well, Coolsculpting is a unique non-surgical method of reducing fat with cryolipolysis. And cryolipolysis is licensed by Coolsculpting by Zeltica, and they have FDA and CE approval, and it's the only one which does have FDA and CE approval.
And what patients are using Coolsculpting?
Well, initially we were using Coolsculpting on patients who are at or near their ideal weight, but we've now expanded that, and we're using it on patients that are even a little heavier, and we're finding with the treatment to transformation that we can get near liposuction results with non-surgical Coolsculpting.
And what about people that are at their almost ideal weight? What kind of results are you getting with them?
Those results are terrific. I am one of those patients. I was actually the first Coolsculpting patient treated in my clinic, and my results are terrific.
You speak from experience.
Absolutely.
And let's talk about how Coolsculpting has benefited your practice.
Well, the wonderful thing about it is some patients don't want surgery, but they want to be thin and trim, and they want to lose those resistant bulges. So they're excellent candidates. The other thing we're finding out is while we're doing the Coolsculpting, many of the patients also want to have other non-surgical things such as injections with neuromodulators and fillers and such. So we've expanded our practice by introducing Coolsculpting.
One leads to the next.
Absolutely. The
And
other interesting thing is we found that 2/3 of the Coolsculpting patients are new patients to our practice. They've never been to the practice.
that's wonderful. So it's a magnet to your office,
Right.
almost.
The other interesting thing is of those new patients, 2/3 of them have never been to any aesthetic practitioner. They've never had plastic surgery or any aesthetic medicine, any injections.
And why do you think Coolsculpting is bringing these patients in? Is it because it's so non-invasive and it's so it doesn't scare them?
Well, it's a couple of things. Number one, it works.
It
And number
works.
two, it's non-surgical.
And
So that
safe.
finally we have a safe, non-surgical alternative to liposuction.
And what is next in line for Coolsculpting in their product development?
Well, Zeltique has come up with a number of applicators. We now have 4, and there's a couple more on the way. There's the Cool Fit, which is a long, flat applicator that allows us to do the inner thighs and the arms and so forth. And there's the Cool Curve Plus, which is smaller, allows us to get around small areas and curved areas. So with these new applicators, we can treat all parts of the body.
So there's a true range
Absolutely.
of products.
And there are many more products coming down also.
Can you talk about that?
No, not yet.
It's a-
You'll just have to wait.
And Coolsculpting, besides the United States, is available
All around the world.
all over the world with approval, FDA, NCE approval, all around the world. And tell me a little bit about your experience with. You said you have men. Obviously, you've a lot of men coming in for Coolsculpting.
That's the interesting thing. We have about 45 to 50% male patients coming in for this non-surgical
half.
reduction in fat. So the men are loving it. And they're coming in, they're having a good time, they're seeing their tummies get smaller and their love handles get smaller, and then they're learning about other procedures. So they're also having some injections and learning about elective cosmetic surgery.
And
so this has dramatically changed the face of my practice.
Yeah, it's almost half of your patients are
Absolutely.
men. And is there a certain skin type that works better with Coolsculpting, or it works for
Coolsculpting is effective for all skin types and all body types.
no risks, no complications?
Well, we've done over 4,000 cycles, and I haven't seen any complications yet. There are some small there are some small issues like bruising in some people, and there can be swelling, but not true complications.
And is there any pre or post precautions that a patient needs to take, or a follow-up after the
No,
procedure?
the patients just come in, they sit on the table, we hook them up, and it's a gentle, safe procedure. They get off, and they drive home. I had it done in the middle of the day and saw patients right afterwards.
And you went to work right after. And how long does it last is the question.
You mean, is it permanent?
Is it permanent? How long will the results last?
Well, we know that the results are long-lasting. They hasn't been around enough to say permanent yet, but they're long-lasting results. Certainly on me, I was treated about 3 years ago initially, and I was treated again about a year ago, and the results have been long-lasting.
And clients are happy.
Very happy.
Happy, satisfied.
They're sending in their friends and family.
Wonderful.
It's a revolutionary procedure. It's changed the face of my practice. We have actually 4 of the machines. I started with 1. It got so busy I went to a second, and this year I purchased my 4th machine.
So it's a Coolsculpting mecca.
Absolutely. It's a Coolsculpting paradise in the Marina.
Thank you so much for
You're
joining
welcome.
us.
Thank you for having me.
Bye-bye.